So you have done all the hard work these last few years and you finally have become a registered nurse. And now you're saying, why do I need a nurse residency program? Why would you want to do more work when you've already done all this work? Why do you want to go into a residency program? Why is it important? What are the benefits of a nurse residency program? Those are all questions I will be answering today in this video, all about choosing a nurse residency program for you. That first year of nursing can be extremely difficult. Let me tell you what, mine definitely was. That transition from new grad, new licensed registered nurse to working on the floor is totally different than your nursing clinicals. And I found it really helpful to be in a nurse residency program. Not only do I think you should be in a nurse residency program, but residency programs have been shown to reduce stress, increase job satisfaction, increase nurse retention rates, and provide support for new nurses, which is the most important part of that sentence. I had the support I needed to be successful in my first year of nursing, and I am so extremely thankful for that. And again, not only do I think it's a good idea, but the CCNE and the American Nurse Credentialing Center recommend that nurse residents complete an accredited program that lasts at least 6 months to 1 year. So it's time to hang up those white nursing school scrubs and start thinking about your career and career advancement and becoming that nurse that you have pictured in your mind. But before we go any further, I want to thank today's video sponsor, TAARA Scrubs, who are making nurses fashionable out there on the floor. So goodbye, white nursing school scrubs, and hello, fluid repellent, sustainable, and made of recycled fabric scrubs. I personally love wearing these scrubs. Not only are they extremely comfortable, but they're maybe some of the only scrubs I can fit into right now, being 7 months pregnant. But not only that, I have received so many compliments about wearing these scrubs at work. My personal favorites are these pants, this Keyhole scrub top, and this white underscrub tee. I absolutely love wearing those, and I still am wearing those being 7 months pregnant. TAARA Scrubs has patterned and solid options on their website, lab coats, and even compression socks. And did I mention these scrubs are super affordable? So go check out TAARA Scrubs using my link in the description of this video. So now that you have your cute scrubs for your new job of nursing, let's talk about what you want in a nurse residency program. First, make sure the program is accredited. If you change jobs one day and that hospital requires you to have attended an accredited nursing program or nurse residency program, and you have not, they may make you do theirs, even if you are a seasoned nurse. I have personally seen seasoned nurses come into a job and they have to do the residency program because they never went through a program in their last job. Or they went through a program and it wasn't accredited. Unaccredited programs can last as short as 6 weeks, and trust me, you will want more time than that in that transition phase from becoming a new nurse to working all on your own. Secondly, when you are sitting for your interviews for your potential position, make sure to ask about the nurse residency program and what it entails. Some include EBP projects, which are evidence-based practice projects. Some offer tuition reimbursement or even sign-on bonuses. So those are also things to consider when you are picking your nurse residency program. And my third point is ask how long the residency program is. Will they be making the schedule for you, or do you have flexibility? Do you get to pick the floor you want to work on at the end of the nurse residency program if you're floating between all the medical divisions? Or are you on just one floor and doing a residency program just for that floor? And so on and so on. Every residency program is very different, and every hospital works very different with their nurse residents. How my residency was is that I floated between all the medical floors in that hospital. I think there was maybe 6. It was like a 700-bed hospital. And I was on all the medical surgical floors or medical floors and surgical floors. I forget how it was separated at that time. And then at the end of my residency, I got to pick from 1 to 3, 1 being my first pick, 3 being my last pick, which floor I wanted to work on and where I saw a good fit for me and with the staff. And thankfully, I got my first pick, which I was super excited about. What I loved most about that setup was that I got to see every single manager and how they ran their floors. I got to work with different staff on different floors and see where I fit in best and see who I worked with best. So if I felt like I didn't have a great working environment on one floor, I knew I wasn't stuck there. I could just go to another floor and say, hey, that's gonna be the last of my pick. Residency programs are so beneficial, as I touched on in the beginning of this video. To recap, look for programs that are accredited, that fit your schedule needs, that fit what you want to do in your career, and that give you the best options for advancement in your career. To find a list of accredited residency programs, accredited nurse residency programs, you can find a link in the description of this video. Again, thank you to our video sponsor today, TAARA Scrubs, but that will do it for today's video, everyone. Thank you for tuning in. Do not forget to subscribe and give this video a big thumbs up. But other than that, that is it. I'll see you in the next video. Have a good day. See ya.